Hello everyone. We've learned a lot as we've continued to manually prone our patients, and we've really optimized the procedure on safely manually proning patients. So we would just want to review that procedure. It may change in the future as we continue to learn and grow in this therapy that we provide our patients. It's currently January 12th, 2021, and again, we may change this as we move forward and we learn and we grow. So I'm just going to teach you, with the help of my friends, how to manually prone, and we'll demonstrate this as we move along. Yeah, thank you.
Oh, wait, sorry.
The first thing that you're going to want to do is alert the respiratory therapist that we're going to be manually proning. This way they can come down, get their other patients taken care of, and come down, and the first thing they're going to want to do is retape the endotracheal tube. They'll get rid of the artificial commercial tube holder and tape the tube. What they're going to want to use is some Cavalon to protect the skin of the patient. And what they may consider doing, so that you're not taping directly on the skin, is use a product called Restore. And this is a hydrocolloid dressing that is the same material that is used in the commercial tube holder. The Hollister tube holder is made out of hydrocolloid. So you could cut this Restore in half and place it on each of the patient's cheeks, and then they're taping it directly to the Restore. The other thing that you're going to want to keep in mind is if the patient has a beard, you're going to want to shave or clip the beard. We try to preserve the beard, and we shouldn't, because then they're taping it higher on the cheeks, and that's led to some skin damage. So go ahead and just shave the beard. It will grow back. The next thing you're going to want to do is think about this patient in the prone position and where the pressure points will be, and to pad those areas, whether it's the knees, using two different types of dressing. You can use the Leave-In Life dressing, go ahead and flip that over, which provides excellent pressure redistribution. It's a good pressure redistribution dressing. The other one that you guys are familiar with, we use with Rotoprone, is the square Leave-In Gentle. You can open the package if you like. This one is sticky, and it's a good dressing, but it doesn't provide as adequate protection as the Leave-In Life. You're going to also want to remove the Foley catheter securer and make sure that the catheter is between the patient's leg. The SCDs, you're going to want to make sure that the hard plastic is not directly on the shin. And then look at other medical devices that may be on the patient. IV tubings, A-lines, and that sort of thing. At this point, if the patient is stable, you can also take them off the cardiac monitor and remove the anterior EKG pads. If you have a male patient, then you may consider protecting the boys by taking a small Leave-In Life and placing that on the scrotum, so that the Foley catheter, as it exits the penis, is resting on the dressing between the Foley catheter and the scrotum. What you may also consider using is a donut, or I like to call it a pronut, where you can cut a wedge in the bottom of the pronut and then place that over the patient to protect his scrotum and penis. There you go. And what you can also do is then you can tape the Foley catheter to the pronut, and so it stays in place. But again, align all of your tubings so that any line that's from the waist down comes towards the foot of the bed, and any line from the waist up goes towards the head of the bed. Now we're ready to gather some supplies. So the respiratory therapist is going to get the pillows ready to prone the patient. And we can use two pillows that we found that were effective are using mitt restraints to secure on the patient with the tube between the mitt restraints, or even better is the Z-Flow pillow, or we call it the squishy pillow. That can be formed, and you can make an indentation in the pillow so the endotracheal tube can be placed in there and it's not causing pressure on the patient's face. So the respiratory therapist should have the pillows ready to go as we get ready to prone. Next thing you're going to do is you're going to slide the patient in the bed away from the ventilator. So the ventilator's on that side. You're going to slide the patient in the bed away from the ventilator, making sure that you have adequate length in the ventilator tubing. So go ahead and slide. And because we're going to turn the patient towards the ventilator. Next thing you're going to do is you're going to put the chucks on the patient. And then you're going to put a flat sheet. I apologize if my video is shaky. I'm not a professional. And lastly, you're going to put a waffle mattress over the patient. Two things to keep in mind with the waffle mattress is when you turn the patient on their belly, you're going to want to have access to the pump sites. So put that down and towards the patient's left foot when you place it on the patient. The next thing you're going to want to do is use the waffle. When we turn the patient over, you're going to use the waffle to secure and support the patient's chest and shoulders. So you're going to take the waffle mattress and fold it under itself so that when we turn them, they're already laying on the waffle folded up. Next, what you're going to do to aid in turning the patient, you're going to first tuck the patient's arm under their body so that when we're turning the patient, we don't roll over their arm. Then you're going to take the chucks, the flat sheet, and the waffle mattress and tuck that under the patient, leaving the rest of the waffle and sheet and chucks on top of the patient. We're going to tuck that under, and then when we turn the patient, the nurse on this side, who is Steve, can grab that from underneath the patient and help to turn the patient. So what we're going to do, now we're ready to turn the patient, and again, the most important person, the person that is directing the turn, is the respiratory therapist. So will you do it on her count, and what we will do is we will go halfway, make sure that the patient is safe and that we have room on all the lines and tubing. If everybody feels safe to continue with the turn, then the respiratory therapist will guide us and count to 3 again and continue to turn the patient all the way in the prone position. So are we ready, team? So Steve will pull up on his side while the other 2 nurses or PCAs will push the waffle mattress further under the patient. So let me back up here, and whenever you're ready, respiratory therapist.
Okay, so we're going halfway. Ready? 1, 2, 3, halfway, and pause.
Okay.
Is everybody good?
Yes.
All right, and then all the way over. 1, 2, 3, over.
Okay. So at this point, the patient is in the prone position, but the waffle is flat. So you want to have the nurse go ahead and start pumping up the waffle while the, not yet, back up. Wait till we poof it up. So as Steve is pumping up the waffle mattress, the respiratory therapist is securing the tube and holding it in place. Once our patient's chest is elevated and supported with the waffle mattress, then we can have some assistance as we place the pillow underneath the patient's head. So, as you may see, as Steve is pumping that up, the patient's chest is coming up off the bed, providing a little bit of a gap for her head and allowing her head to rest. So as the RT holds the patient's head and secures the tube, the nurse can come in and help assist with the pillow. And again, with that squishy pillow, we can make a nice indention in it so that the tube is not pressing up against the patient's lip and not kinking the tubing. Okay, that all looks good. The patient is now in the prone position. Next thing you're going to do is put the patient in the swimmer's pose. So, sorry about the video. Okay, so go ahead and put one arm above the patient. If the patient is not paralyzed, you're going to make sure that the patient is restrained. And it's tricky to restrain that one arm, especially if it's on the side of the ventilator. So this swimmer's pose is real important to maintain comfort of the patient and prevent any kind of injury to the arm nerves or arteries and veins. So, and then the next thing you're going to do is make sure that the toes are not touching the bed by tucking the waffle mattress underneath the patient's shin and making sure that the toes are not touching the bed. You may need to put an additional pillow on there again to just offload the toes. So the patient's in a good position, got the endotracheal tube secured and not kinked. Now the maintenance of this patient, and then you're going to put the patient in reverse Trendelenburg so that you can decrease swelling to the face and also provide better expansion of the diaphragm and the expansion of the lungs. Routine maintenance of the patient in the prone position is that at a minimum of every 2 hours, you're going to reverse the prone or the swimmer's pose, and we're also, we'll do that, one arm up, the other arm down, and then we're also going to turn the patient's head in the other position. You may not always be able to turn the patient's head, but try your best at doing this so that you're not causing any injury to that side of the face or the neck. So every 2 hours you're going to reverse the swimmer's pose and try to reposition the head. The next thing you're going to do every 2 hours is then tuck a pillow underneath the waffle mattress so that you're offloading the patient to prevent pressure injuries on the patient's ischium or the trochanter. Much like we do every 2 hours on a supine patient, just make sure you offload them. I believe that's all we have to cover. So thank you, and if you have any questions, see one of us. Our fearless leader, Steve, Becca, our shift coordinator, Lauren, our clinical advisor, Karen, our clinical advisor, Brandon, our educator, or me, your clinical nurse specialist. Thank you all.